Welcome all of you to this live program at Orthopedic Principles. Today our guest of honor is Dr. Lucius Pomerantz from San Diego, California. Dr. Pomerantz is an orthopedic surgeon based out at San Diego. After his graduation at the Albany Medical College, he pursued his orthopedic surgery residency at the University of San Diego and then later completed his hand and upper extremity fellowship at the Campbell Clinic in Memphis, Tennessee. He's certified by the American Board of Orthopedic Surgery and is a fellow of the American Academy of Orthopedic Surgeons. He's also a member of the American Society for Surgery of the Hand and is part of its Ethics and Professionalism Committee. Dr. Pomerantz has published several peer-reviewed articles and has been a contributing author towards multiple book chapters. He's passionate about Brazilian Jiu-Jitsu. He's a black belt holder and has also participated in competitions involving mixed martial arts. So today is my great honor to introduce you to Dr. Lucius Pomerantz from San Diego. Over to you, Lucius.
Hey, thank you for having me. It's an honor myself to be here and talk to you all. So, ready to get going. All right. So, I as a little background, while I went through my medical training and my orthopedic surgery resident, I was also competing, not only in Brazilian Jiu-Jitsu, but I did some mixed martial arts bouts. And I have a unique perspective on these things. And so not only am I going to present some injuries that you might see in these athletes around the hand and wrist, I hope to also kind of give some appreciation for these martial artists and combat sports athletes. Again, I hope you can not only understand some of the injuries you might be seeing, but understand some of the rules of mixed martial arts, understand how the equipment and the situations they might find themselves in the fights might influence the injuries they may have. And I'll certainly be focusing more on the mixed martial arts thing, but this carries over to a lot of the martial arts that you may see, whether it's boxing or kickboxing or Brazilian Jiu-Jitsu. So injury rates. Note the published literature out there on injury rates about any of these sports are not the highest quality studies. It's hard to glean good data, but in general, you can kind of see that mixed martial arts, the data out there, there's a similar injury rate to boxing or karate and probably also wrestling and things like that. And point is, injuries happen to the hand and wrist, especially. Our hands and wrist are how we interact with the world, and in combat sports, we're certainly interacting with the person in front of us. So those hands and wrists definitely are injured during these sports. And then a lot of us are more familiar with boxing. And that's where two opponents are standing up across from each other. And you're only striking your opponent from the waist up to the head. You're not allowed to grab. You're not allowed to throw the person. Whereas in mixed martial arts, a lot more can happen. The fight can go to the ground. There are takedowns. You're often grasping and grabbing at your opponent. You can't grab the ring, but things can certainly be caught on the ringside cage if that's the venue. And then you're allowed to strike different areas of the body, and the angles in which the strikes are coming from also change the forces that our hands are going to see compared to boxing, along with the different gloves. So a little bit about the gloves that you're going to see in these different sports. Mixed martial arts, usually the gloves are smaller, 4 to 6 ounces. They stop just proximal to the proximal interphalangeal joint, which does open up a type of injury that I'll be talking about momentarily. And because the thumb is independent and free, that also not only helps you grab and grasp at things, but subjects the thumb to different forces and injuries. So as we go into this a little bit more, these gloves, on the left there, you've got a kind of demonstration of how the thumb might get caught or bent backwards, opening you up for hyperextension or injury similar to a gamekeeper's injury. Whereas if you look closely on the image on the right, that is a open dislocation of a PIP joint. So these gloves will influence the injuries you may see compared to other combat sports. And this made the news, and this is now a while ago, but A fighter had the fight stopped because they couldn't find his finger. It was his left ring finger. It was folded up inside of his glove. It had become dislocated. His opponent had actually kind of pulled on the glove, finger flipped up inside of it. And well, it was a shock and surprise to everyone. And fortunately, with a reduction in the emergency room, everything was okay. But interesting forces, interesting injuries that can happen in the realm of mixed martial arts. And as I was alluding to earlier, we're familiar with this injury. We see it in a lot of different situations, but it can definitely happen in mixed martial arts due to that independent thumb as opposed to the boxing glove. Now, the boxer's knuckle or a sagittal band injury is also something that is going to happen. The gloves in mixed martial arts are thinner. The angles in which they strike may land on the fist in a slightly different way, and that I think does increase the risk of having a radial sagittal band rupture. And this is a situation where that extensor stabilizing mechanism over the knuckle is disrupted and the extensor tendon may fall off. Usually the injury is to the radial sagittal band and the tendon will then fall off ulnarly, and you'll notice that the patient may have an issue extending that finger until that tendon gets pushed back over, and then they can extend it. Just a little side note from me, I'm a big fan of these yoke splints that you can see at the bottom there. I think a lot of these injuries can actually be treated conservatively. That being said, if you're dealing with a high-end athlete who's looking to get back in the most predictable way, fastest way, surgery is definitely still an option to stabilize these extensor tendons. So the positions, this is a representative situation where very different than other martial arts, where because there's takedowns, because there's situations where they're going to be on the ground, the angle in which you are striking your opponent is going to be very different. There are still rules. You can't hit from kind of the bottom of the neck, behind the ears, up to the top of the head. There's this square in the back that you're not allowed to hit. But if that's what's facing you, you might have to loop your punches and come through at different angles to find a way through their guard and not do an illegal strike. And that's going to change how your hand lands on your opponent and opens you up to certain injuries. And this is why, compared to other striking sports, we're going to see more first, second metacarpal fractures. Usually, even you might get the butterfly fragment of that bending or transverse type of injury of forced landing when they're landing on the radial side of the wrist. But there's also hammer fist. So instead of the classic boxer's knuckle to the fourth or fifth metacarpal, you're going to get a transverse shaft type of fracture. And often they're going to keep fighting. Even though they break their hand, they're going to figure out a way to keep going. That usually results in additional fracture displacement as the fight goes on. And this is an x-ray of a fighter, Mark Hunt, who put his images up online. And I think it was just a fairly good representation of the different types of metacarpal fractures you're going to see in mixed martial arts compared to other martial arts. Another more unique injury that can happen because submissions, trying to make your opponent tap out, is part of mixed martial arts and part of jiu-jitsu and sambo. Specifically trying to choke your opponent. This picture on the left here is the guillotine choke. It involves you're bringing your hand through, you're pulling on your wrist, you're going to be putting stress on that ulnar part of your wrist. Sometimes there is a little bit of supination to it to put force across their neck with your forearm. And speaking from personal experience, you can injure that extensor carpi ulnaris in its subsheath. I had this injury doing this exact move. I thought I had it, ripped my hand through, and my wrist was sore for more than a few months there. You're not necessarily going to stop a fight because of this injury, but the patient's going to notice it afterwards. And then, yes, there's obviously going to be falls. There can be big takedowns, big throws. This picture is showing the middle of a elbow dislocation happening from a fall on an outstretched hand. But clearly injuries at the wrist can happen from this, and this includes TFCC injuries, scapholunate injuries, I haven't seen a distal radius fracture, and that probably is because the ground is a little padded and these guys are healthy and have as good a bone as you can get, but certainly it could happen. And then elbow dislocations as the force translates up further the arm certainly happens, and an elbow dislocation would certainly end the fight. A little bit more about the TFCC. Again, this is often from a fall on an extended wrist, and the forearm goes into a little bit of pronation. But it can be that traction injury, similar to maybe going for a guillotine. And yes, for those of you who aren't specifically hand surgeons, to simplify this structure a little bit, we do think of this as kind of a meniscus of the wrist. Clearly, it's doing other things such as stabilizing the distal radial ulnar joint. But you talk to hand surgeons and we'll have entire lectures about this single structure and debate on its best treatments and how it actually gets hurt and if you need to do certain things. A little bit more about the scapholunate injury. Different forces. The scapholunate injury is along this spectrum of injury where as you fall on that outstretched hand and the carpus goes into supination and the wrist into ulnar deviation, a series of things start twisting and pulling, and eventually it could even end up into a perilunate dislocation. But certainly the level of forces that you're going to see from the fall in these athletes is going to not usually result in a perilunate dislocation, but more of the scapholunate injury. And when you're evaluating these patients afterwards, it's important to look for that on x-ray. You might need dynamic types of x-rays, whether it's clenched fist or at least comparing to the other side to delineate on x-ray. MRI, have a quick threshold if you're suspecting a scapholunate injury. So just a little side note, as a ringside physician, the things that you're considering when ringside and having to make a decision about whether the fight continue. And the key is, can the fighter defend themselves? It's pretty amazing what these fighters will tolerate in the middle of a fight. They will have a broken hand and continue on. There's a kind of a legendary story of one of the now old school legends of the sport, Uriah Faber. He broke both of his hands pretty early in the fight and yet kept going. And the change you saw was he was using his elbows to try to strike his opponent. So these guys are extremely tough. And so you sometimes have to protect them from themselves. And you also have to assess, is this something that's a catastrophic injury? Some of these guys may be able to continue fighting with a dislocated PIP joint. They may try to reduce it themselves. They may pop it back into themselves. But if they're at high risk of turning it into an open injury, well, that's bad. And we know all of the risks that can go along with an open injury, infection, injury to deeper structures such as nerve, and you can't allow the fight to continue. Being a ringside physician is really all about communication. You are talking with the referee, you're talking with the fighter themselves, seeing how they're doing. And I just want to point out that unfortunately, a lot of these combat sports athletes get the reputation of perhaps not being extremely smart. Sometimes it's earned, but a lot of these guys are extremely intelligent and they understand what's going on, but they're also extremely tough. But whether they're trying to hide an injury or you're trying to explain to them that, hey, the fight's got to end because of this, that they usually will come around. Oh yes, this is a clip of actually a peroneal palsy from a leg kick, and he got dropped. He can't extend his toes, which you'd see later in the fight, but he changes the fight, takes the guy down. He's not going to be standing up anymore. So these guys are extremely tough, and will figure out ways to work around injuries mid-fight. Just a little note about being ringside and what you should be looking for. This is a photo after big name Conor McGregor actually broke his leg in the ring. But quick, you got to do these exams quick. And I always give the hands a tight squeeze. You might see a wince. That that should encourage you to look a little bit closer, making sure that there's not a broken bone. Sometimes you've got to encourage them to go to the emergency department to get x-rays. In general, if they do have a dislocation, if you feel comfortable, it's worth giving it a shot, trying to get things reduced. We all know that a reduction as soon as possible gives a better outcome, but it's not something that you should try more than once and get the patient into the emergency room so they can do it in a controlled environment at least. To kind of conclude, there's lots of ways that these guys may injure their hands or wrists. An injury doesn't necessarily mean that the fight will be over. It certainly can influence the outcome of a fight, but if they're intelligently defending themselves, can continue on, you can give them that chance. They may hide their injuries from you the best they can. You have to sometimes protect themselves from them. You may have to protect them from themselves. And it's an amazing sport. It's growing. It's one of the fastest growing sports in the world. And chances are, you're going to start treating athletes who've participated in these sports. So I appreciate your time and attention, and thank you.
Thank you, Lucius. Lucius, you can stop sharing. You can close your PPT, actually. Thank you, Lucius, for this crisp presentation. I mean, you've gone through what is actually essentially required for the understanding. Lucius, just a few questions from our side. Now, I think what is critical is prevention, right? Prevention of these injuries. You mentioned about the right size of gloves, the padding, and what about the kind of training? There's a lot of emphasis on strength and endurance training, right? So can you give us an idea about that? Endurance training, there's a lot of these unique exercises targeting proprioception.
Sure. Yeah. Okay. So, yes, there's going to be a lot of things that these athletes are going to be doing to hopefully prevent injury. And a lot of it is starting with the conditioning. I think we all intuitively know, but I think the research shows that when there's central fatigue, neuromuscular fatigue, you are opening yourself up to have less reaction time, and something that you would be able to avoid before. You'd be able to move your body differently. And once you are fatigued, you are going to be more susceptible to injury. And so these guys, the conditioning work that they're putting themselves through, I mean, it's intense. They're putting themselves through the endurance that it would take to do 3 fights to get ready for 1 fight in their training. Multiple guys, fresh guys every round while they go through 6 rounds, even though the fight might be 3 rounds. So conditioning is a huge part of cardiovascular, central fatigue, getting all of that to be in line. Obviously, they're working their muscles. They're getting strong, and it's sport specific. And with a sport like mixed martial arts, there's all kinds of different places they might end up. And so, yes, they're gonna be doing jump rope to have that hand-eye coordination and endurance within their foot, ankle, calves to be moving. But they also have to be on the ground and be able to have the forces to stand up. So the muscular conditioning these guys are putting themselves through is very diverse, and is whole other lectures. There's some very smart athletic trainers out there who are now focusing on mixed martial arts, and I'll have to defer to them. A question I get a lot is specific hand wrist strengthening, and classically there's stuff going back hundreds of years with karate and other martial arts like that, using rice to shove your hand in it and get conditioning there and move your hand around. And I think building strength around the hand and wrist is never going to hurt. That being said, a lot of these injuries to the hand and wrist aren't because they're the muscles in the forearm. And as we know, there's no muscle into the fingers. There's some muscle in the hand. All the muscles really are up in the forearm, but they're not responding fast enough. When your fingers are out, you're defending a punch or a kick, and your fingers get hyperextended and you've got a glove stopping it. And so you get that hyperextension through the PIP joint. No matter of strength of the hand is necessarily going to prevent that. People talk about conditioning our bones, strengthening the bones. We know Muay Thai fighters are notorious for kicking trees and strengthening their shins. And, you know, perhaps as our adult skeleton adapts over 7 to 10 years to the forces that we put our body through, sure, you can strengthen the bones and give them a representation of the forces they might see. But again, there's a limit no matter what you do. And injuries are inevitable. And I think the things that people really should pay attention to before they get into a fight is knowing how to wrap their hands. This is tried and true, goes back a long time. It often takes experimentation and figuring out how you like your hands wrapped, giving it support is going to help prevent the metacarpal injuries, the CMC joint injuries, and wrist injuries. So that is something you can work on in training and before an actual match that should not be neglected, hand wraps.
And there are concerns with fatigue as well. If you do if your exercise have gone beyond a level, there's a possibility of fatigue. And that is also a risk factor, right? You're susceptible. You don't have full control of your body, and fatigue itself is a risk factor, right?
Fatigue is huge. It makes a coward of us all, but when your reaction times are slower, you aren't responding the way you're used to being responding because your body is tired, because your muscles are already broken down, you're susceptible to injury. And a big part of the training for these guys is learning how to recover. And all of us, when we're 20, we may not feel the urge to learn how to recover because our bodies can recover fairly fast. But as we get older, certainly as I've gotten into my 40s, I've really had to learn how to make sure I'm recovering, because what I would used to be fine with after a day or two, now I might notice for a few weeks. And if I'm not giving my muscles or tendons a chance to recover, I'm opening myself up for injury. And we know things like the rotator cuff or the quadriceps tendon or things like that. If we keep pushing and we're not giving our chance to recover, there might be a rupture. And then now you're looking at surgery instead of what could have been just treated with rehab and time. So yes, recovery, having conditioning so you avoid fatigue, but at the same time realizing when you got to pull back and give your body a chance to recover.
And Lucius, you mentioned you had an injury, right? Was it an ECU subluxation? What was that?
Yeah, it wasn't the full subluxation, fortunately. I went for that guillotine in training, and the guy was moving fast, and so I tried to go really fast and felt a little pop and hurt at that ulnar aspect of my wrist. And it probably was a little subsheath injury, but I fortunately was not unstable. I probably could have done a better job at making myself recover and heal from it. Definitely, it's an injury. You know, we think maybe 3 months, but for me, it lasted a bit longer than that. I could still operate. I could still do the things I needed to do. But for those of you who treat patients with an ECU subsheath injury, just realize if it's 6 months later and they're still complaining of pain, yeah, it heals slow. And we're using that tendon for a lot of stuff. But yeah, over the years, I've had, unfortunately, a few injuries. They're becoming a little more frequent as I get older, and I'm having to change the way I train a little bit. I'm not a young man anymore.
Thank you, Lucius. Lucius, I think that's all the questions that we have for this session. Thank you for this wonderful talk, brief but complete, and looking forward for more in future.
Yes, thank you. I appreciate your time and patience. And I look forward to doing this more, and I will be prepared.
Bye-bye.
Take care.